EMT Prometric questions and answers. Questions 226 to 250. 226. In addition to oxygen therapy, the most effective way to minimize the detrimental effects associated with cardiac compromise is to A. Give the patient up to 4 doses of nitroglycerin. B. Reassure the patient and provide prompt transport. C. Transport the patient rapidly, using lights and siren. D. Request ALS support for all patients who have chest pain. The answer is B. Reassure the patient and provide prompt transport. 227. Which of the following questions would be most appropriate to ask when assessing a patient with chest pain? A. What does the pain feel like? B. Does the pain radiate to your arm? C. Would you describe the pain as sharp? D. Is the pain worse when you take a deep breath? The answer is A. What does the pain feel like? 228. Which of the following statements regarding one rescuer CPR is correct? A. You should assess the patient for a pulse after 3 cycles of CPR. B. A compression to ventilation ratio of 15:2 should be delivered. C. Ventilation should be delivered over a period of 1 to 2 seconds. D. The chest should be allowed to fully recoil after each compression. The answer is D. The chest should be allowed to fully recoil after each compression. 229. You are caring for a 66-year-old woman with severe pressure in her chest. As you initiate oxygen therapy, your partner should A. Notify medical control. B. Obtain a sample history. C. Measure the blood pressure. D. Gather the patient's medications. The answer is C. Measure the blood pressure. 230. When managing a patient with chest pain, you should first A. Administer high-concentration oxygen. B. Place the patient in a position of comfort. C. Request an ALS ambulance to respond to the scene. D. Measure the blood pressure and administer nitroglycerin. The answer is B. Place the patient in a position of comfort. 231. What is the most detrimental effect that tachycardia can have on a patient experiencing cardiac compromise? A. Increased blood pressure. B. Increased oxygen demand. C. Increased stress and anxiety. D. Decreased cardiac functioning. The answer is B. Increased oxygen demand. 232. After applying the AED to a 56-year-old female in cardiac arrest, you analyze her cardiac rhythm and receive a shock-advised message. First responders, who arrived at the scene before you, tell you that the patient was without CPR for about 10 minutes. You should A. Perform 2 minutes of CPR and then defibrillate. B. Detach the AED and prepare for immediate transport. C. Deliver the shock as indicated followed immediately by CPR. D. Notify medical control and request permission to cease resuscitation. The answer is C. Deliver the shock as indicated followed immediately by CPR. 233. During transport of a patient with a head injury, what assessment factor will provide you with the most information regarding the patient's condition? A. Pupil size. B. Heart size. C. Mental status. D. Blood pressure. The answer is C. Mental status. 234. A young man fell and landed on his outstretched hand, resulting in pain and deformity to the left midshaft forearm. Distal circulation should be assessed at which of the following pulse locations? A. Radial. B. Brachial. C. Pedal. D. Popliteal. The answer is A. Radial. 235. You are called to a local nightclub for an injured patient. Upon arrival, you see a young man who is lying on the ground screaming in pain. Bright red blood is spurting from an apparent stab wound to his groin area. Your first action should be to A. Control the bleeding. B. Apply 100% oxygen. C. Ensure an open airway. D. Elevate the patient's legs. The answer is A. Control the bleeding. 236. During a soccer game, a 20-year-old man collided shoulder to shoulder with another player. He has pain and a noticeable anterior bulge to the left shoulder. What is the most effective method of immobilizing this injury? A. An air inflatable splint with the left arm immobilized in the flexed position. B. A long board splint with the left arm immobilized in the extended position. C. A sling to support the left arm and swathes to secure the arm to the body. D. The sling to support the left arm and swathes to maintain downward traction. The answer is C. A sling to support the left arm and swatches to secure the arm to the body. 237. Which of the following mechanisms of injury would necessitate performing a rapid trauma assessment? A. 5 feet 8 inches tall adult who fell 12 foot from a roof and landed on his side. B. A stable patient involved in a car crash whose passenger was killed. C. Amputation of 3 toes from the patient's left foot with controlled bleeding. D. An impaled object in the patient's lower extremity with minimal venous bleeding. The answer is B. A stable patient involved in a car crash whose passenger was killed. 238. You are assessing a 33-year-old male's Glasgow Coma Scale, GCS, score. The patient opens his eyes in response to pain, is speaking with incomprehensible words, and withdraws from pain by flexing his upper extremities. What is his GCS score? A. 6. B. 7. C. 8. D. 9. The answer is B. 7. 239. The police summon you to a residence for a domestic dispute. When you arrive, you are advised by a police officer that a man, who is now in custody, shot his wife. When you enter the residence, you see a woman lying supine. She is conscious, but very restless, and is in obvious respiratory distress. After ensuring a patent airway, your next course of action should be to A. Apply 100% oxygen. B. Assess respiratory quality. C. Compare carotid and radial pulses. D. Check the condition of the patient's skin. The answer is B. Assess respiratory quality. 240. The police summon you to a residence for a domestic dispute. When you arrive, you are advised by a police officer that a man, who is now in custody, shot his wife. When you enter the residence, you see a woman lying supine. She is conscious, but very restless, and is in obvious respiratory distress. During which part of your assessment would you be most likely to discover a small caliber gunshot wound, with minimal bleeding, to the back? A. General impression. B. Initial assessment. C. Rapid trauma assessment. D. Detailed physical examination. The answer is C. Rapid trauma assessment. 241. The police summon you to a residence for a domestic dispute. When you arrive, you are advised by a police officer that a man, who is now in custody, shot his wife. When you enter the residence, you see a woman lying supine. She is conscious, but very restless, and is in obvious respiratory distress. Upon discovering an open chest wound, your first action should be to A. Prevent air from entering the open wound. B. Begin assisted ventilation and prepare for transport. C. Immediately reassess the patient's ventilatory status. D. Cover the wound with a trauma dressing and reassess the patient's ventilatory status. The answer is A. Prevent air from entering the open wound. 242. When applying a vest-style spinal immobilization device to a patient with traumatic neck pain, you should A. Immobilize the head prior to securing the torso straps. B. Secure the torso section prior to immobilizing the head. C. Ask the patient to fully exhale as you secure the torso. D. Gently flex the head forward as you position the device. The answer is B. Secure the torso section prior to immobilizing the head. 243. Which of the following findings would indicate that a patient is in decompensated shock? A. Diaphoresis and pallor. B. Falling blood pressure. C. Restlessness and anxiety. D. Heart rate greater than 130 beats/min. The answer is B. Falling blood pressure. 244. General care for an amputated body part includes A. Immersing the amputated part in cold water to prevent further damage. B. Thoroughly cleaning the amputated part and wrapping it in a sterile dressing. C. Wrapping the amputated part in a moist, sterile dressing and placing it on ice. D. Wrapping the amputated part in a moist, sterile dressing and keeping it warm. The answer is C. Wrapping the amputated part in a moist, sterile dressing and placing it on ice. 245. You are called to a local knife-throwing contest, where a 42-year-old man has a large dagger impaled in the middle of his chest. Your assessment reveals that he is pulseless and apneic. How should you manage this patient and his injury? A. Carefully remove the knife, control the bleeding, and begin CPR. B. Carefully remove the knife, control the bleeding, and attach an AED to the patient. C. Secure the knife in place with a bulky dressing and transport immediately. D. Make sure that the knife is secured, initiate CPR and transport immediately. The answer is A. Carefully remove the knife, control the bleeding, and begin CPR. 246. Rapid extrication of a patient from an automobile is most appropriately performed by A. Applying an extrication collar and removing the patient from the car using the direct carry method. B. Applying an extrication collar, sliding a long spine board under the patient's buttocks, and removing the patient from the car. C. Applying a vest-style extrication device and sliding the patient out of the car onto a long spine board for full immobilization. D. Maintaining support of the head, grasping the patient by the clothing, and rapidly removing the patient from the car. The answer is B. Applying an extrication collar, sliding a long spine board under the patient's buttocks, and removing the patient from the car. 247. During your rapid trauma assessment of a critically injured patient, you should assess the chest for A. Symmetry and pain. B. Rigidity and guarding. C. Crepitus and distension. D. Distension and guarding. The answer is A. Symmetry and pain. 248. Following penetrating trauma to the abdomen, a 50-year-old woman has a large laceration with a loop of protruding bowel. How should you manage this injury? A. Carefully replace the bowel and apply an occlusive dressing. B. Carefully replace the bowel and cover the wound with a moist, sterile dressing. C. Apply a dry, sterile dressing covered by an occlusive dressing. D. Apply a moist, sterile dressing, covered by a dry, sterile dressing. The answer is D. Apply a moist, sterile dressing, covered by a dry, sterile dressing. 249. During the initial assessment of an unconscious trauma patient, you find that the patient is breathing inadequately, has a weak radial pulse, and is bleeding from a lower extremity wound. You should direct your partner to A. Radio for an ALS ambulance to respond to the scene. B. Apply direct pressure to the bleeding as you assist ventilations. C. Initiate positive pressure ventilations as you control the bleeding. D. Prepare the long spine board and straps for rapid immobilization. The answer is C. Initiate positive pressure ventilations as you control the bleeding. 250. While removing a hot radiator cap, a young man sustained partial thickness burns to the anterior chest and both anterior arms. Based on the rule of nines, what percentage of his body surface area, BSA, has been burned? A. 18%. B. 27%. C. 36%. D. 45%. The answer is B. 27%.